Dear colleagues, ladies and gentlemen, it would be wonderful to be with you in Cairo at the Hilton Heliopolis for the 13th edition of BGICC. Unfortunately, we are in a difficult situation worldwide. This wonderful meeting that is organized by Professor Ghazali and all his colleagues has many topics around the key question challenging the impossible and written with the I am being struck down because it is possible. And my role here in this first session is to talk to you about challenging in oncology management in the COVID era and its vaccination. So I'm Matti Aapro. I'm a medical oncologist based in Genolier in Switzerland, and I have the pleasure of knowing many of you, and some of you also know me. And I'm also the president of the European Cancer Organization. But before going to that, let me just share here with you a slide about my so-called conflicts of interest. As I work with many drug companies according to the established guidelines. I don't see any conflict of interest in this, but some people do. So I will be discussing with you some points about this virus, the disease, COVID, and the positions and contributions of many around this problem. So let's start with European Cancer Organization. As I said, I'm the president until the end of this year of the European Cancer Organization. Some of you probably do not know what the European Cancer Organization is. It has changed completely in the past 2 years. We now represent 34 member societies, professionals, mainly from Europe, but in some societies also colleagues outside of Europe, and very importantly, 20 patient advocacy groups that form what we call the Patient Advisory Committee. I'll show you a slide in 1 minute. And our aim is to amplify the voice of the professionals and of the advocacy groups in all areas of oncology and in all professions related to the avoidance or improvement of the cancer situation of patients. These are the logos of the member societies. Publicly, I do regret the European Society of Medical Oncology is not a member for reasons due to misunderstandings of the past, but we are working hard on getting, again, a very good collaboration with the European Society of Medical Oncology. The patient advocacy groups are here. As I said, there are 20 of them. They represent patients with all types of diseases and also in all European countries, maybe not all societies in every European country. One of the recent developments in the European oncology area has been the adoption of the European Code of Cancer Practice, which was put forward by our member societies and patient advisory groups, and which states very clearly, presently available in 24 European languages, and soon in many other languages, to inform patients about 10 key areas where they have rights, where they should be able to ask for answers, and they are here: equal access, very important, information, quality, expertise, and outcomes in the centers, the multidisciplinarity when they're taken into the treatment, sharing the decision-making between the patient and professional, supporting research and innovation, quality of life, supportive and palliative care being part of the overall treatment, and when the treatment is over, survivorship, rehabilitation of the patient, and reintegration of the patient into the society. All very important points, which were highlighted by the launch with the presence of the European Commissioner for Food and Health, Stella Kyriakides, in September last year. We work as networks, with those members interested in a particular network sending representatives and experts to this particular network. They are depicted here on the slide. I will not detail them to you. Everything is available on our website. What I would like to say is that, of course, as every single society throughout the world, we had to create a working party that we call a network on the impact of COVID-19 on cancer. We had recently the European Cancer Summit. This is not a standard meeting. This is a meeting with representatives of all the different societies, of also from all other societies that would like to have representatives, and also from European authorities. As you can see on the right-hand side of the slide, also non-European, like Princess Dina Mired, past president of the Union for International Cancer Control, that you certainly know from your neighbor country, Jordan. And of course, we discussed COVID-19. Everything is available, recorded discussions on the website. You have the reference on the slide, but you can also go to our website and have some more written information. An important intervention during the summit was about the impact of COVID-19 on cancer by Bente Mikkelsen, Director, Non-Communicable Diseases, World Health Organization. One of her slides is this one. At the point that she was making the presentation, WHO had received reports from service disruption in cancer treatment, unavailability of medicines in the treatment of cancer and, of course, COVID, and disruption of palliative care services in almost half of the countries, probably an underreporting, as commented by Dr. Mikkelsen. The WHO has defined priorities that we should be tackling in this area, cancer and the existing pandemic. Obviously, we can decide that what is of high priority might not be as high in our country as other priorities, but this representation of the fact that those cancers that have a very rapid evolution are clearly an emergency for treatment, and alternative treatments that do not really make major impact on patient survival might certainly not be in this COVID area, in an area in which we need to give any priority as far as organizations go. Of course, for the patient, everything is very important. The chairs of the focus topic networks on COVID-19 are Miriam Krul and Mark Lawler, and they made the presentation of the work of the network. And this is a document that is available on our website that addresses the situation. It's a 7-point plan, of course, directed at Europe, but might give you some ideas on what you might want also to implement in your countries. Of course, you have to adapt everything to your reality, which is somewhat different from the complex European reality. As you know, Northeast, Southwest in Europe, things are quite different. The 7 points are here on the slide. Once again, I'm not going to be detailing them to you. Everything is available on our website. But what I'd like to emphasize is the last point. This COVID crisis has taught us in Europe, and I hope in the whole world, that health has no borders. Health issues are similar. They're not the same, but they are similar throughout the world. And the impact of this crisis and the dramatic lack of communication, and these are my personal words, the dramatic lack of communication, especially at the beginning of the crisis, between those that had to make decisions, certainly did not help the way we in Europe addressed this problem. This is now understood and realized, and there are, I hope, solid plans by the European Union to move forward under the direction of the President of the Commission, Dr. Ursula von der Leyen, who has put forward the fact that we have to emphasize health cooperation in Europe. Europe has traditionally left the health area as something that the states have to deal with, except some specific situations. We all believe in the European Cancer Organization that this time is over and we have to work much more closely one with the other. The European Society of Medical Oncology has done a remarkable work for all medical oncologists in Europe and elsewhere by helping us understand, thanks to the expertise in the society, on where we are, what can we do, and I'm not going to be, of course, able to detail everything in the few minutes that have been allotted for this presentation. But I would like to give you the resources that are available so that you can then, by yourself, go and see if there are some information that could be useful for your exact situation. ESMO has put forward on its website guides for patients on cancer care, COVID-19 recommendation slide sets, disease area per disease area. Of course, some of this guidance was done a few weeks, a few months ago. They moved very quickly within ESMO and might need to be somewhat readapted. The work is going on within ESMO. As I said, all disease areas are addressed by ESMO, and all of this is available on the ESMO website. An area that you certainly know is very dear to my heart is supportive care. And ESMO has adapted, of course, the guidance about supportive care for all our cancer patients. I would like to highlight this because many of the issues related to the present COVID crisis are related to the fact that this is a contagious disease. This is a disease that puts patients at risk, especially when their immune defenses are in some ways disrupted by active chemotherapy. One of the important messages I'd like to convey to you is that the issue is with active chemotherapy, not with cancer, except some specific situations like some hematological malignancies, and not with hormonal treatment with breast cancer, for example. Of course, the elderly, as you all know, are at the higher risk of complications if they catch the virus, and some guidelines on how to envisage treatment for the elderly were published by the International Society of Geriatric Oncology in 2020. So you want to know about vaccines. Where do we stand with the vaccines? Well, very recently, on January 13th, there was a wonderful meeting organized by one of the parliamentary groups, the EPP group, called Towards the European Health Union. You have here the logins to the various sites. The easiest, in my understanding, is the Facebook website, in which you can see the full recording. It's a little bit long, it's 2 hours and 17 minutes, something like that, of the whole meeting. In this meeting, as you can see on this slide, you had representatives of the societies that have presently their vaccines available in Europe, Pfizer, BioNTech, and Moderna, and also representative CureVac. And the very important message here for you is that it was clearly stated that the present vaccines, at least those of these companies, are active also against the variants. Everyone is speaking about the variants, the United Kingdom variant and the variant in South Africa seem to be perfectly sensitive to these vaccines because of the way they act and recognize the virus. So before the end of last year, in December 20th, ESMO released some 10 statements. Again, I have no time to deal with these. These are important statements about the facts known about the vaccines at that point. Everything is evolving, of course. But what is very important is the call of ESMO that when we use vaccines, we should use them in a way that we can record what is going on and see the real impact also in our cancer patients in different settings. And the very important message is, even though we do have the vaccine that is coming in many countries, This is not the time to stop what we are doing in order to avoid the contagious disease. This is not the moment to decrease the use of everything we have to do in order to avoid this contagious disease. Do not do the Swiss style. This is what is unfortunately happening in the country in which I live. We did not close our skiing slopes with catastrophic results. As you can see from the left, you see even some skiers without a mask, and we are not getting in Switzerland the population to respect the use of the mask and to respect the distances. And this is a picture in downtown Geneva just a couple of days ago. So do not behave this way. Continue to be careful, because it's only by avoiding the contagious disease that we will make progress, that will protect the population overall until the vaccines reach us. And please help us convincing those that do not want to have a vaccination that this is absolutely needed. The ESMO statements are, as I said, on the ESMO website. Some of them are very well supported by the existing review of literature that you have here on the slide. Of course, this is, as I said, an area which is evolving, and this is going to be updated as time passes by. So let me finish my intervention about the challenges in oncology management and vaccination with the words of Commissioner Kyriakides just a few days ago. All over the world, I'm adding this, all over the world, cancer patients have been hugely affected by COVID-19. The disruption that this has created for treatment, screening, all vaccination programs, clinical trials, and access to medicines has been dramatic in the whole world. And this has put a huge level of uncertainty and anxiety among citizens, among patients, among their families. If we had cooperated better in Europe, we would probably have avoided some of these issues. This is me adding to the words of Commissioner Kyriakides. With this, I would like to conclude and thank you again. Thank you very much, Hashem, for having asked me to give this introductory talk in this wonderful meeting that you're organizing. And see you all in 2 days, on Friday afternoon or evening, for the consensus session. Thank you.